And hi everyone, newcomers and and familiar faces. Let's say that, Daniela. So this is the fourth in a series of five learning lounges. So today we'll be talking about health and well-being. I would encourage you to have a look at the recordings of the others. And next week we'll be looking at promoting a positive and effective working environment. And these learning lounges are intended to support our Care Leaders Bootcamp, which is a program of resources that are sent out to support either aspiring managers in the care sector or new managers or existing managers that just want to think about things in a different way and spend a bit of time paying attention to these topics. So there we go. Alex has put the link to join the Care Leaders Bootcamp. I would thoroughly recommend it. Alex has put some great resources together. We've got 25 minutes, so we haven't got long. I'm going to jump straight into it and talk about what we're going to cover today. I should introduce myself as well, just say who I am. So my name is Mark Story. I'm the Head of Learning Innovation at Future You. And in my career, I've been focused primarily on two things. One is what makes organizations work well, and the other is how does the development of people improve the performance of organizations. So they're the two things that I've been focused on in my career. And a lot of that, of course, has come down to managers, how we equip managers to do all the million and one things that managers have to do. And hopefully today is just half an hour out to think about one aspect of your management role, and that's health and well-being, and how we can support the health and well-being of others. But specifically, the things that I want to cover. So those of you that are familiar with these sessions, I'm going to spend just a minute talking about the 3 principles of self-development. I think that's really important. Then we'll get into health and well-being, and I'm going to talk a little bit about what is the problem. So we're probably familiar with what health and well-being is, but how does it kind of translate into a challenge and an issue for us? Then we're going to spend some time thinking about how to spot somebody who is exhibiting poor well-being. What do these people look like? And once we've identified them, how do we then support people's well-being? As always, we'll summarize at the end. I'll give you some key takeaways. There'll be some additional resources that myself and Alex can point you to. And then we'll happily go on our way, and I will see you next week. So the first thing that I want to cover is the 3 principles of self-development. I really am keen for everybody to internalize this. If you're trying to improve in anything, whether it's management, whether it's supporting health and well-being, whether it's your role as a carer or a nurse, a care professional, whether it is, I don't know, knitting in your spare time or playing hockey at the weekends, whatever you might be doing, these 3 principles apply. The first one is self-awareness is the key to self-development. So knowing yourself, knowing what you're good at, knowing what you're not so good at, is absolutely crucial if you're going to embark on any development and any improvement activity. So understand what it is that you're good at and what it is that you're not good at. Second thing is that real life gives us all the opportunities to practice that we should ever need. So of course you can go to books, of course you can attend sessions like this. These are great for picking up knowledge, but it's the application of that in the real world that the real world provides us with all the opportunities that we need. And the third thing is it's really important to reflect on how we're doing in the real world, and often having somebody to help us reflect and somebody to help us unpack the lessons that life is giving us can be really important to build our self-awareness and therefore support our self-improvement and self-development. So I very much encourage you to internalize these, take these 3 principles and apply them to any part of your life that is important enough for you to want to improve in. Okay, with that done, I will move on to the topic of the day, which is health and well-being. And the first thing that we're going to think about is, what is the problem with health and well-being? And I've got a quote here, excuse me, from the National Institute for Health. So, first of all, stress and mental health are one of the biggest causes of sickness absence in the UK. So it's about a quarter of all sickness absence is related to stress and mental health. But within social care, it has even higher levels of stress and mental health and higher levels of sickness absence among all of the professions in the UK. So there are some real high pressure professions in the UK, like being a prison guard or a police officer or being a teacher, but being a care professional, it absolutely trumps them all. And to put this into perspective for you, so on average, a person just in an average job, doing an average thing, will probably take about 6 days off a year as a result of sickness. But in the care sector, that is more than double, almost treble. It's 16 days that your average care professional will take off in a year. And a quarter of those, at least, are related to stress and mental health. So there is a huge prize here if we can support our staff and support their well-being, that we actually get more of their time to be at work and for them to be attending work. And as a result, we can take some of the pressure off that understaffing and high sickness absence rates that we experience. So it's a bit of a vicious circle, and we'll come on to this at the moment, that the more people are experiencing stress and mental health issues, the more they go off sick. The more they go off sick, the more the people that are left have to overwork, and they get stressed and their mental health gets affected, so they go off and so on. If we can break that cycle, then there's a real opportunity there to support everybody's mental health, and as a result, improve the quality of care, because we'll have more staff available to care for our service users. So, what are the things that that result in stress and mental ill health that cause people to go off work? So here are some of the things, and I'm sure that you can come up with a list of lots of others. So first of all, staff turnover. Let's talk about staff turnover. If you ask anybody about what they like about a job, often they'll talk about the people that they work with, the immediate team that they work with, and the relationships that you build in that team are often really important in how you feel about the place that you work in. And if there's lots of staff turnover, which there is in the care sector, then it's really hard to build those relationships. People will come and go. There may be a real range of cultures as well, and people staying for a short time. It's hard to build those relationships and that sense of real belonging. So staff turnover can have a real impact on relationships, and as a result on our mental well-being. But also staff turnover means that often we're understaffed in our organizations, which puts additional pressure on us, which again affects our mental well-being. It's a low pay sector, and there is a range of people calling for higher pay. There's the minimum wage going up next year, but still it is a sector that is characterized by low pay. And the impact of that is that a lot of people's attention is focused on how they're going to pay the bills, or what happens if the car doesn't get through its MOT, or the food choices that they make tend to be different because of the pay that they're getting. So low pay in general can cause an impact on people's health and well-being. The working environment that people work in, so it can be a difficult, challenging, busy environment. And if we go to the bottom right, the emotional demands of that working environment can make it really challenging for people. So if you're working in a care home, for example, you might experience death on a regular basis. You might experience a whole range of different emotions and very powerful emotions that can take a real toll on your health and well-being. So the working environment, the nature of the work and the emotional demands of the work can have a real impact. And of course, if we've got high staff turnover, if we're understaffed, if we're in a low pay environment, it might encourage us to be working longer hours than are good for our health. I know lots of carers who will regularly work 7 days without taking a break, and they'll regularly be working 12-hour shifts on those days. And I'm sure you know many, if you haven't even done it yourself, where it may be that you finish an 8-hour shift or a 12-hour shift and there's nobody to take over from you. And what can you do? You have to stay on and you have to make sure there is a continuity of care for the service users. So all of these factors combined make social care a real hot pot of potential health and well-being issues. So we've established that it's a real problem, and we've established some of the reasons why it's a real problem. And some of these things are such big problems, they're not things that we can resolve directly. But what we can do is we can equip ourselves to be able to spot people who might be experiencing poor health and poor well-being. So here are some thoughts. And again, there's a really good resource that Alex has got that's part of the Care Leaders Bootcamp that goes into more detail on here. But ultimately, what you're looking for is change in people. So when you get to know your staff, you're looking for moments at which things change about them. So it might be, first of all, it might be appearance and behavior. So it may be that they're taking less effort, or they're looking more tired, or maybe they're losing weight or gaining weight. There could be a whole range of things about their appearance and behavior that suggests that they're making poorer choices about their own personal appearance or health and well-being. We're all familiar with, you know, when you get really stressed and so on, you might comfort eat, you might drink, you might turn to drugs. All of those things can have a health impact on your sleep or an impact on your weight, a whole range of different things. It may be that you start paying less attention to housework or to ironing or whatever it might be. And as a result, your appearance and your behavior can change. Mood and attitude, looking for differences in mood and attitude. So somebody that was fairly pleasant maybe starts becoming irritated or angry at small things. It may be that somebody that gets on well with other people starts not getting on well with people or snapping at them. Or it may be that people withdraw into themselves when they were, you know, pleasant or outgoing in the past. All of those things could suggest to you that there is something going on with that person that might be related to health and well-being. When you're thinking about their work and productivity, so it may be uncharacteristic mistakes. It could be that they're finding it difficult to remember things that you tell them to do. It could be that they start second guessing themselves and become unsure and unconfident about some of the routine tasks that they usually carry out with no problem. The work and productivity is a really important one, because when you're having a supervision or an appraisal, or you're giving somebody some feedback, there is the real potential here to make things worse. So if you go in and talk about somebody's mistakes that they're making, or the fact that they're not paying attention, and you're honing in on the fact that they're not paying attention, without first checking, is everything okay? How are you doing? How are you feeling? Then you might actually be making that sense of health and well-being worse rather than better. So when you're having your management conversations about how well somebody is performing, I think a good tip is always to start by asking them how they are. And I think going back from that, a good tip for management generally is to have a sufficient relationship and rapport with your staff that you're able to notice these character changes. If you know how a person generally is when they're feeling okay, then I think you'll be in a better position as a manager to identify when they're not okay. Timekeeping and absence is the fourth one. So has there been a change in the amount of time that they're taking off, or are they arriving late and they didn't used to? Are they wanting to work longer hours and really push themselves through it? They all might be signals that somebody is in need of our support and in need of our help. So what this boils down to is change, knowing your staff sufficiently to know what they're like, what they're good at, what they're not so good at, so you can see whether things are changing in them. And you can start those conversations by asking them how they are, as opposed to jumping in and talking about how their uniform isn't ironed or they're late. We can actually make the situation better by seeking to understand how they're feeling first. So what do you do if somebody is experiencing poor health or poor well-being? Bearing in mind, often we can't control understaffing, we can't control low pay, we can't control the emotional demands of the environment. So what are some of the things that we can do? First of all, Future You has got a bunch of wellness resources. I think all of our courses now have got a chapter that just does a small section on wellness. And that's recognizing that you as the care professional, you as the caregiver, you need to be looking after yourself if you're going to be looking after other people. But what we've also got is a really great program called the Wisdom Program. I would encourage anybody to go onto the app and to access that. It's a really great program for making sure that you get more of the emotions that you want and less of the emotions that you don't want. And from there, it will signpost you to some other modules that take you into a deeper dive on some of those topics. There's some really practical things that people can do, and it's a practical set of resources that you can signpost people to for free. Second thing is professional development. I might have mentioned this in a previous session, that one of the markers of poor mental health is the inability to learn. And it's not saying that when you're experiencing poor mental health, you lose the ability to learn. It's just the two are correlated. So if you're encouraging people to take on professional development, you're encouraging them to explore and expand their skill set, then actually you can break that cycle. And just by flexing their learning muscles, people might be able to then better control their emotions and their mental health. So learning is a great way of getting people underpinning support for their health and well-being. Positive work environment. We're going to talk next week about creating a positive work environment. I hope you can attend. It's going to be a really great session because I'm going to be asking you what makes you happy. And that is a lovely question to ask. And it makes everybody happy being asked that question and getting to say what makes them happy. So positive work environment is a really important one, and I would encourage you to attend next week. Showing gratitude, so just being respectful of people and telling them that you appreciate them for who they are, for the work that they do. It doesn't cost anything. It feels a bit awkward, but it has a real impact on people. Setting an example if you are a manager who is working 80 hours a week and you're never taking a break and you're rushing around and you're only considering yourself as being productive if you're really stressed and busy, you're probably setting an example that is what everybody else should be doing too. So making sure that you take breaks, making sure that you support your own health and mental well-being is a really important example to be setting for your staff. Listening. Alex has got some great resources on active listening. So when you're in supervision or when you're having an appraisal, when you're having a one-to-one with people, remember you've got 2 ears and 1 mouth, so you should be doing more listening than talking. And if you start those sessions by saying, so, how are you? And then don't say anything else, just have silence and wait for that person to respond and give them the opportunity to really be listened to. Sometimes in our busy lives, we find that actually nobody ever asks us that. You might see a friend and they'll say, oh, hi, how are you? But they're not actually asking you how you are, they're just saying hello. So sitting somebody down and asking them how they are can be a very powerful way to get people to open up and talk about what's going on with them. Getting feedback. So going back to the 3 principles of self-awareness is the key to self-development. A real integral part of that is getting feedback from people. So ask staff, how can we support your health and mental well-being more? What could we do? And you'll be surprised at how inventive I think staff can be. It's not all about pay rises and bonuses and time off. It could be some real important things that they could tell you and reveal to you rather than leave you guessing. And finally, signposting support. So I'm sure that as care professionals, you are aware of a network of resources that people can access. Maybe just build a list of those and have those available so you know where you can send people. There's apps that can give counselling. There's employee assistance programs. There are a whole range of free resources that support people's health and well-being. As I mentioned, Future You wellness resources. Just make sure you've got a list to hand so you can refer people to them as they need it. So, with 4 minutes to spare, that brings us to the summary. So we believe that by implementing these good health and well-being practices, that you as care professionals can build a dedicated and skilled workforce that can continue to provide even higher levels of quality care for your service users and residents. And there are 4 things that I'd like you to take away from this. First of all, care workers are at more risk. This is a tough sector to be in. So it's really on you to be vigilant, to be supportive, and remember that putting things in place does not have to cost you money. But if we can reduce the amount of sickness absence that people have, we break that vicious circle and we can be more supportive and find ourselves in a more positive working environment. Get to know your team and notice changes in their behavior. So as a manager, get to know what normal is for your people so you can spot when things are different. And make sure that you're asking the question how they are and finding out before you go down that disciplinary route of telling them off for being late again. Get feedback, ask staff what impacts their well-being, involve them in the solutions that you're bringing about. Don't try and guess or impose things on people. Find out exactly what people want. And they might just want, I don't know, a toaster in the staff room, or they might want the opportunity to have a social evening, or they might just want to be referred to some kind of support. So find out from staff so you're not guessing on their behalf. And by doing all of these things, we can break that vicious circle or vicious cycle. So if we're not supporting people's health and well-being, we find that more people are going off sick. As a result, it's putting more strain on the people that are there, and they'll end up getting sick or having mental health problems. So if we can break this cycle, actually it becomes a virtuous circle, and we can get more people in work, and as a result, people will be less stressed and more healthy. So that brings us to the end of our session. Just a few things to make you aware of. First of all, there's part of the resources that I mentioned, and Alex has just put a link to it in the chat. There's a really good wellbeing checklist for managers. So things for you to look out for, and things that you might do in response if you notice any change in people's behavior. So you can scan that QR code, you can follow the link that Alex has put in the chat. And in order to access your CPD certificate from this session, you can again follow the link that Alex has put in the chat. You can have a look at the QR code. When you go onto the CPD site, you put in your email, and then your CPD certificate will be downloadable from there. So, pressing the wrong button. Thank you very much. Are there any questions?
Yeah, good afternoon, Max.
Good afternoon, Jennifer.
Last week I was unable to download the CPD. The link, I didn't have it on my email. I tried.
Oh, let me, I've got your email address, Jennifer. So what I'll do is I'll email you directly with the link so that you have it. And if you have any other trouble, you can just email me back and let me know, and we'll get to the bottom of it for you.
Okay, thank you very much.
Nice
session.
Thank you, Jennifer.
Thank you too.
Okay, well, thank you very much, everybody. I really hope to see you next week. Next week will be a fun session because I get to ask you what makes you happy, and we'll talk about creating a positive working environment. So have a great week, and we will see you next week.
Thank you.
Thank you, everybody. See you soon. Bye-bye.
Bye-bye.
Bye. Bye.